You finish, you relax, and then you think, right, I'd like to go again, but my body's saying absolutely not. If you're a man over 50 and your reset time after ejaculation feels like it's getting longer every year, that can be frustrating, confusing, and sometimes a bit bruising to the ego. But here's the reassuring truth. The refractory period, which is simply the recovery time after orgasm before you can get another erection, is not just willpower, and it's not just age. It's a set of switches in your nervous system, hormones, blood flow, and pelvic muscles, and if you understand those switches, you can often shorten the time significantly, sometimes from an hour to 20 minutes, or from 20 minutes to 5 or 10. Not always a few minutes every time, and not for every body, but there are practical ways to improve your odds without doing anything risky. In this video, I'll explain why the refractory period tends to lengthen with age, what makes it suddenly worse, the 2-minute reset you can try immediately after ejaculation, and the longer-term strategies that make second rounds more realistic. I'm also going to share the one sign that tells me you're fighting the wrong battle, because if your issue is circulation rather than arousal, the fix is different. Welcome. My name is Victoria Ashford, urologist, and if you want more calm, evidence-based men's health guidance, do like, comment, and subscribe. Stay with me, because in a moment I'll show you the fastest non-medicine way to switch your body back into erection mode after orgasm, and most men have never been taught it. Let's start with what's actually happening in your body right after ejaculation, because this is where the war metaphor can mislead you. After orgasm, your body deliberately flips into a recovery state. The sympathetic nervous system, which is your fight or flight mode, the one that speeds your heart and tightens blood vessels, briefly dominates. At the same time, certain hormones shift. Prolactin, which is a hormone that rises after orgasm and is linked with sexual satiety, basically the I'm done signal, tends to increase, while dopamine, which is your motivation and reward messenger, drops. Oxytocin, which is the bonding hormone that also brings a sense of calm, can rise too. So, in plain English, your body is trying to help you rest, not rally. That's normal physiology, not failure. And here's your first micro hook. The fastest way back isn't more effort. It's learning how to stop triggering the shutdown signals that keep you in recovery mode. Now, one big point for seniors, the refractory period varies wildly between men, and it's affected by cardiovascular fitness, sleep, stress load, medications, and how intense the orgasm was. Yes, intensity matters. A very strong orgasm often comes with a bigger sympathetic spike and a stronger prolactin rise, which can mean a longer recovery. Quick question. Does your recovery take longer after a very intense finish compared with a gentler one? If you've never noticed, pay attention next time, because that observation alone can guide your strategy. In a moment, I'll explain a technique that reduces that spike, so your body can return to arousal sooner, and it's surprisingly simple. Let's do a quick myth buster before we go further. Most people think the refractory period is purely about testosterone. Testosterone, which is the main male sex hormone involved in libido, meaning sexual desire, does matter, but it's not the main switch for getting a second erection quickly. Many men with normal testosterone still have long refractory times if their nervous system stays in stress mode or their circulation is sluggish. And many men with slightly lower testosterone can still go again if blood flow and relaxation are right. So don't get trapped in the it's all hormones story. Here's the hook. The next thing I'm going to say sounds almost too basic, but it's the number one reason men can't get back to an erection after ejaculation, even when they're still mentally keen. Breathing and muscle tension. After orgasm, many men unconsciously hold their breath, clench their abdomen, and tighten their thighs or buttocks, especially if they're trying to force the next erection. That tension keeps the sympathetic system switched on. Remember, erections prefer the parasympathetic nervous system, which is your rest and digest mode, the one that opens blood vessels and supports arousal. So the immediate goal is not more stimulation. It's switching your body out of fight or flight and back into rest and digest. Do this with me now, even clothed, even sitting on your sofa. Breathe in gently through your nose for a count of 4, then breathe out slowly through the mouth for a count of 6 to 8. Do 2 rounds. That longer out-breath is like tapping the brakes on the stress system. Now relax your jaw. Yes, your jaw, because jaw tension often mirrors pelvic tension. And here's your micro hook. In a moment, I'll give you the post-ejaculation reset sequence that combines breathing, pelvic release, and timing. And it's the closest thing to a reliable shortcut without medication. Before that, let's talk about blood flow, because this is where aging genuinely matters. An erection is a pressure system. You need good inflow, blood coming in through the arteries, and you need good trapping, veins being compressed so blood doesn't drain out too quickly. After ejaculation, the penis often loses some of that trapping tone. If your arteries are a bit narrower due to vascular aging, which simply means blood vessels getting less elastic over time, then regaining firmness quickly can be harder. This is why erection changes can sometimes be an early sign of cardiovascular strain. If your erections are weaker overall and your refractory period has suddenly lengthened over a few months, that's worth a proper health check. Blood pressure, cholesterol, and blood sugar, because diabetes, which is chronically high blood sugar, can affect nerves and vessels. Stay with me because later I'll tell you the 2 clues that suggest you should prioritize a medical review rather than just techniques in the bedroom. Now, let's get practical. Here is the immediate sequence you can try right after ejaculation, and I want you to think of it as reset, then rebuild, not panic and push. First, 30 to 60 seconds of stillness. I know that sounds counterintuitive, but it prevents the body from associating orgasm with frantic effort, which reinforces sympathetic activation. Second, the long exhale breathing we just did for 2 rounds. Third, a deliberate pelvic floor release. The pelvic floor, which is the sling of muscles under your pelvis that supports erection rigidity and ejaculation, often stays clenched after orgasm. If it stays clenched, it can actually reduce comfortable blood flow and keep the nervous system on edge. So instead of squeezing, do the opposite. Imagine you're letting the muscles around the anus and base of the penis drop and soften, like unclenching a fist. If you're not sure you're doing it, try this simple cue. Gently open your mouth, sigh out, and let your belly soften. That often allows the pelvic floor to let go. Then, and only then, you reintroduce arousal gradually, not intensely. Why? Because you're trying to rebuild parasympathetic arousal rather than triggering another stress spike. Micro hook. In a moment, I'll explain the arousal ramp that makes a second erection more likely than jumping straight back in. Let me give you a quick imagine this moment. Picture a man in his late 60s who tells me, I try to go again straight away, but it's like pushing a car uphill in the wrong gear. That's exactly it. The gear is wrong. Your body is in recovery gear, and you're demanding performance gear. The arousal ramp means you start with what reliably turns you on without pressure. For many couples, that means touch, kissing, warmth, and slow stimulation that feels pleasant even if the penis is soft. That pleasure matters because it reactivates dopamine, which supports motivation and arousal. Quick question. Do you and your partner treat the in-between time as awkward silence or as part of intimacy? If it becomes awkward, your brain reads threat, and threat kills erections. If it becomes relaxed and playful, your body switches on faster. And here's the hook. The next part is where many men accidentally sabotage themselves within the first 2 minutes. They start checking the penis, watching it, judging it, poking it, testing it. That monitoring pulls you into performance mode. Instead, pick a different target. Target warmth and sensation rather than hardness. That's not me being poetic. It's neurological. Your brain's arousal circuitry responds to sensation, and sensation comes before firmness. So a practical tip is to keep stimulation pleasant but not frantic. and keep your attention on what feels good rather than what it looks like. Viewer participation prompt. Next time, see if you can go for 60 seconds without checking once. Just notice sensation. In a moment, I'll give you one little trick that makes that easier if your mind tends to race. Now let's address the big question you're probably thinking. But doctor, how do I do this in a few minutes? Sometimes you can, but we need to be honest about what makes a few minutes realistic. If you still get regular morning erections, which are erections during sleep and on waking, a sign the plumbing and nerves can still function, your second round potential is often better, and techniques may work quickly. If morning erections are rare, erections are weaker overall, and your libido is lower, it may take longer, and you may benefit from medical support. That's not pessimism. It's matching expectations to biology. Micro hook. In a moment, I'll tell you the difference between normal aging refractory time and a warning sign refractory time. Let's talk about the mind trick I mentioned. Right after orgasm, your brain often drops into a satisfied, sleepy state. That's partly oxytocin, partly prolactin. So rather than fighting sleepiness with stress, use novelty and curiosity gently. Novelty doesn't have to mean anything extreme. It can mean changing position, changing pace, changing type of touch, or even changing the room lighting. The brain responds to new cues. But do it gently and playfully, not urgently. A simple technique is to re-engage with a question. What feels nicest right now? That question shifts you into curiosity, which is arousing, rather than evaluation, which is stressful. Be honest. When you're trying for round 2, are you curious and relaxed, or are you testing and tense? That answer is very revealing. And here's your hook. Next, we'll cover the physical factors that can shorten the refractory period over weeks, not just minutes. Fitness and circulation are the unglamorous truth. Aerobic fitness, which is your heart and lung endurance, improves endothelial function, meaning the lining of your blood vessels relaxes better and delivers blood more efficiently. This directly supports erection quality, and better erection quality often means a shorter refractory period because your system can repressurize faster. You don't need to become an athlete. A brisk 20 to 30-minute walk most days can be enough to change vascular responsiveness over time. Resistance training, strength work, can also help by improving insulin sensitivity, meaning your body handles blood sugar better, and stable blood sugar supports nerve function. Microhook, stay with me because in a few minutes I'm going to connect this into a simple 7-day plan that many men can actually stick to. Sleep is another big lever. Poor sleep increases stress hormones and reduces testosterone production. But more importantly for this topic, fragmented sleep increases sympathetic tone, which means your baseline is already wired. If you snore loudly, wake with headaches, or feel unrefreshed, consider sleep apnea, which is repeated breathing pauses in sleep because it reduces oxygen and can worsen erections and recovery time. Again, that's not just about sex, it's about heart health too. And here's a micro hook. The next factor is one many seniors overlook because it sits in the medicine cabinet: medications. Several common medicines can lengthen refractory time or reduce erection reliability. SSRIs, which are antidepressants that adjust serotonin, can reduce arousal and make it harder to return to an erection quickly. Some blood pressure medications, particularly older beta blockers, which slow the heart, can contribute in some men, though many alternatives exist. Prostate medications can also affect ejaculation and arousal patterns. This doesn't mean you stop anything, it means you have a sensible conversation with your prescriber. Since starting this, my sexual function changed. Often timing changes, dose adjustments, or switching to a different option can help. Pattern shift moment. I once spoke with a gentleman in his early 70s who assumed he was just getting old, but his longer refractory period started the same month he changed an antidepressant dose. Once his GP adjusted the plan and we added a simple arousal ramp strategy, his recovery time improved noticeably. Not overnight, not magically, but enough to restore confidence. And confidence, by the way, is not fluff. It changes nervous system state. Now let's talk about food, hydration, and alcohol, because these can make the difference between 5 minutes and 45 minutes for some men. Heavy meals divert blood to digestion. That means less blood flow prioritized for the pelvis. Alcohol may feel relaxing, but it can dull sensation, dehydrate you, and reduce the strength of the erection reflex. So if round 2 matters to you, keep meals lighter, drink water, and consider moving alcohol earlier or reducing it. Quick check. Do you notice you're more capable of a second erection in the morning or earlier in the day than late at night? If yes, fatigue and digestion are likely major factors. Microhook. And in a moment, I'll share a simple timing hack couples use that often makes second rounds easier without changing anything else. That timing hack is this: stop treating sex as the very last event of the night. For many seniors, late-night intimacy is competing with sleep pressure, full stomach, and low hydration. If you shift intimacy earlier, say after a walk, after a shower, before a heavy meal, you often get a better first erection and a shorter refractory period. Another practical trick is warmth. A warm shower or bath can increase peripheral blood flow and help relaxation. Not scalding, not exhausting, just warm. And here's your micro hook. Now we're going to cover targeted aids that can reduce refractory time, including one that works by supporting blood flow rather than forcing arousal. Let's talk about PDE5 inhibitors, which are medications like sildenafil or tadalafil that support the erection pathway by keeping nitric oxide signaling active. Nitric oxide is the chemical relax and open signal that helps blood enter the penis. These medicines don't create desire. They make it easier for arousal to translate into a firm erection. For some men, tadalafil in a low daily dose can reduce the time needed to get another erection because it maintains a baseline support for blood flow throughout the day. But these must be prescribed and used safely. If you take nitrate medications for chest pain, combining them can dangerously lower blood pressure. If you have heart disease, you need individual medical guidance. And be cautious. If you ever get an erection that lasts more than 4 hours, that's priapism, which is a prolonged erection that can damage tissue, and it needs urgent medical attention. I'm saying that not to scare you, but to keep you safe. Another tool is a vacuum erection device, which is a pump that draws blood into the penis mechanically and can be used with a constriction ring in some cases to reduce blood outflow. For men with weaker circulation, it can make round 2 possible when it otherwise wouldn't be. It's not about turning your sex life into a science experiment. It's about giving your body a bit of help when the plumbing needs support. And here's your hook. If you prefer to avoid devices and pills, there's still a powerful, often overlooked method that's entirely about muscle coordination. Pelvic floor training, but done properly. The pelvic floor muscles help trap blood and maintain rigidity. However, many men do them wrong by constantly clenching. That can create tension and even pelvic discomfort. What you want is coordination, a gentle squeeze when you need support, and full relaxation when you don't. Try this daily for 2 weeks. Gently contract as if you're stopping urine midstream for 2 seconds, then fully relax for 6 seconds. Repeat 10 times. The long relaxation is the important part. Do not practice by repeatedly stopping urine while actually urinating, because that can irritate the bladder. If you have pelvic pain, a physiotherapist who specializes in men's pelvic health can help you learn proper release and control. Micro hook. And in a few minutes, I'm going to give you a simple after ejaculation routine that uses pelvic floor release first, then a single supportive squeeze later, at exactly the right time. Now I want to address something sensitive but common, the relationship dynamic. If round 2 feels like a test, it becomes harder. If it's framed as, let's see what happens, no pressure, it becomes easier. There's a reason for that. Pressure triggers adrenaline, and adrenaline tightens blood vessels. So here's a practical couples script you can borrow. Give me 2 minutes to reset, and let's keep it relaxed. If it happens, great. If not, we still enjoy ourselves. That line protects your nervous system. Viewer prompt. Could you say that out loud without embarrassment? If not, that's a sign the pressure is higher than you think. And here's the micro hook. Next, I'll give you the exact routine, step by step, that many men can use to shorten the refractory period in real life. Right after ejaculation, do not jump into frantic stimulation. Instead, do 60 seconds of calm connection. That might be cuddling, kissing, gentle touch, even just lying together. Then do 2 rounds of long exhale breathing, in for 4, out for 6 to 8. Then do 20 to 30 seconds of pelvic floor release, imagining a gentle dropping and softening at the base. After that, reintroduce arousal with low-pressure stimulation that feels good even without hardness. After 1 to 2 minutes of that, if you feel any natural swelling returning, then and only then, add a gentle pelvic floor lift for 1 second on an exhale. Just 1, not repeated squeezing, because that can help trap blood at the right moment without creating tension. If the erection doesn't return, don't punish your body with stress. Stay in pleasure, stay relaxed, and try again later. Often the second attempt works better because you've kept parasympathetic tone rather than spiraling into disappointment. Micro hook. And now, here's how to make this easier over the next 7 days, so you're not relying on luck. For the next week, focus on 4 levers: circulation, calm, timing, and triggers. Circulation means 1 brisk walk a day, even 15 to 20 minutes, because it improves blood vessel responsiveness. Calm means 1 minute of long exhale breathing, twice a day, so your body learns the switch. Timing means experimenting with intimacy earlier in the day or earlier in the evening, not after a heavy meal and alcohol. Triggers means noticing what lengthens your refractory period: very intense orgasm, stress, late-night fatigue, dehydration, or checking behavior. Keep it curious, not judgmental. And here's a micro recap to reset your attention. Round 2 is most likely when your body is relaxed, blood flow is supported, stimulation is consistent, and your mind isn't monitoring like a referee. Now, the 2 clues I promised that suggest you should prioritize medical review. First, if you rarely or never wake with morning erections, and erections are consistently weak in every situation, that points more towards vascular or hormonal factors. Second, if there's a sudden change over weeks or a few months, especially with new breathlessness, chest discomfort, leg pain with walking, or new numbness, that deserves a proper checkup. Erectile changes can be an early sign of wider vascular health issues, and catching those early is genuinely important. If you ever have sudden severe chest pain or symptoms of a stroke, facial droop, arm weakness, speech difficulty, seek urgent medical help immediately. Safety always comes first. Let's end with a warm, realistic truth. For many seniors, getting a new erection in a few minutes after ejaculation won't be every time reliable, and it doesn't have to be. The goal is not to fight your body. It's to work with your body so intimacy feels confident and enjoyable again. When you shorten refractory time, you're usually doing 3 things. You're calming the nervous system, you're supporting blood flow, and you're removing performance pressure. If you try the reset routine, the arousal ramp, and the 7-day plan, you may notice improvement sooner than you expect. Sometimes the very first time, often over a couple of weeks as confidence and physiology align. And here's one last micro hook before we finish. In the next video, I'll show you the everyday foods, supplements, and healthy habits that quietly make erections less reliable after 60, and what to swap them for without feeling deprived. If this helped, please like, share, and subscribe, and tell me in the comments, what's your biggest obstacle after ejaculation? Is it sleepiness, anxiety, loss of sensation, or just time? Your answer helps me tailor future videos. Take care of yourself, stay healthy, and we'll see you in the next video.